Okay. So if you pull the patient's lip too like that, this becomes straight. You can't feel the mucous buccal. Okay. You should just pull a bit like that. Don't make it straight. Okay. If you make it straight, then your needle will come out. Okay. So make sure if it's a premolar, for example, you are in the mucobuccal fold. This depression. This depression. Okay. So you take a tweezer, ask your assistant to suction first, clean the area, and then you wipe the area. Okay. So you can give a mirror. Okay. So you can take a mirror and retract like that. You see? And you wipe the area. Okay. Then you throw it. Then you take the applicator tip. You take the topical. So we just open. Okay, so you take the topical and then you apply in that area. Then you just rotate like that. Okay, because if you keep it like this, it won't stick there. It will just come down because of gravity. So keep it like that, or keep it like that, and just rotate, and then the topical will stay there. Okay, same way for palatal. Again, you dry the area. Just below the teeth here, you just apply topical. Same way. Okay, so buccally and palatal, you have to apply topical first. Okay, then you have to wait for 2 minutes. Let it set. But you have to inform the patient why you are doing this. So patient needs to know what you're doing. Say, I'm applying topical so that it becomes a bit numb before I give you the anesthesia. Don't say before I give you the injection. When you get scared, just say anesthesia. Okay. So once then you throw this, then you take your needle. Okay. Then you take this. Retract. You have to remove the topical fluid. Okay, if the topical is there, you can't see your point of entry because it will be all smudged everywhere because it will be mixed with saliva. Okay, so you remove the topical both here and here. Okay, here when you remove, don't do this way. You go into the throat. This one gag. Okay, so do inside out. Do this way, the chances that you go into the tonsil. If anesthetic solution falls inside the tonsil, the patient will start coughing continuously. Will have a gag. That happens, ask the patient to drink water and gargle. So when the water will dilute the drop of anesthesia. Okay, so going out, here is very simple. You can do it here. Then throw this, okay. Then you take your, this has to be on that. Here. Okay, so this will be like this. Okay, you just do like this. Don't do like this, because it will get bent. Okay, so if it's not coming, just ask your assistant to hold this, and then you just slowly rotate it. Okay, then you can retract. Now you need to see where is the bubble of the needle. Okay, you see here, arrow points towards the bubble. So the bubble of the needle, if it's a premolar, for example, first premolar, you see where is the mucobuccal fold. Okay, you keep it parallel in the midline to that tooth. So you see, like this, and you need to come from this side. Okay, you see, parallel to the tooth. But since maxilla is a bit inwards, you need to go like that a bit. So there will be a gap here. Okay, there will be a gap here, but you're still parallel to the tooth. So stay in the center of the tooth. Don't go like that. That means you are giving just to the mesial root. Don't go like this because you are giving just to the distal root. If you are in the center, the solution will go evenly on both sides. Okay, so you just be here in the center, just go parallel, and this point, bubble should be towards the bone. Okay, and your apex of the needle should be, the tip of the needle should be above the apex. So in the X-ray, you need to see how long is your root. Okay, so usually you see the length of the maxilla in a patient. If it's a short maxilla, you don't have to go so deep. If it's a long maxilla, then you might have to go a bit deeper. But rest everything is the same. Okay, so make sure you're slightly angulated inwards. And there's a gap here. Okay, and then you don't have to aspirate because it's a non-aspirating. Then you just give 0.5 ml. Okay, then this is buccal. Okay, now try that. All of it. Cleaning with the suction, removing the saliva, wiping, and then applying topical, then removing the topical. If you want, patient can gargle also after that. Those are same whether it's now block or infiltration. Doesn't change. Only your depth of your needle, your angulation of the needle changes. Okay. So suppose for example this tooth root is not like this, and it's a bit like that, because some roots can be mesial or this. Then you just angulate your syringe and needle the same direction. Your needle tip should be, suppose this is the tooth root, should be above the apex of the tooth. Should not be below. Then it won't be effective. It has to be above the apex. Okay? Then the anesthesia will be on top and it will completely anesthetize. So that's why your depth of penetration is very important. See in the X-ray how long is the root. Okay? If it's a child patient, you don't have to go so much. Just a bit only. Because most of the deciduous tooth roots are resolved. Okay? So try. We are asked to give anesthesia for the extraction of a premolar tooth or whichever tooth. You have to give both. If you give one side and sit, the examiner won't say anything, you will lose half the mark. Because you cannot extract. Okay? Okay, try. No, you can ask anything. You can ask molars also. If you ask molars, there will be a nerve block. Suppose you ask maxillary molar, you want to extract the maxillary molar. Okay? And we ask you to give the anesthesia. Then you have to give greater palatine and you have to give buccal infiltration.
There won't be situations where you have to remove two incisors.
Yeah, if you have two incisors, you give between both the teeth. Solution goes in between. If it's more than three, then you give a nerve block. It's much easier. Because if it's more than three, you give once here, then you have to give again here. The more you prick the patient, the more you lose the patient. The patient will go outside and say, I went to the dentist, he pricked me 10 times just to remove one teeth. That doesn't give a good impression. The less you prick the patient, more patients will get. Okay, so try first buccal infiltration.